this and we find out that Hava's teeth are very white. Too white, they're off the scale.
I'm not on that. That's good.
Yeah, I think you whitened them especially for this video, didn't you? Having a good day. My name is Nicola Gore. I'm a dentist, and this is...
I'm Hawa. I'm a therapist.
We're going to talk about teeth whitening.
We are.
Yes.
Hot topic.
Absolutely. You know what's the first thing you see about them?
I definitely see the teeth
You
first.
Okay.
Eyes, teeth.
Yeah, so statistics show, so people have actually done research on this. First is eyes.
Yeah.
So always, ladies, eye makeup. Second, teeth. So floss. Third, shoes.
Shoes. I was going to say it's shoes.
Shoes, yeah. And you know what? It's very strange. I don't look at anyone's shoes, do you?
Oh, I do.
Really?
Yeah.
Okay, I don't. I do look at...
To basically pick Nicola's brains for you guys.
On a Saturday.
On a Saturday. Shall we start with when a patient comes in, they want the whitening done, first thing that you're doing?
Okay. So is listen first to your patients to see what exactly what they're looking for. Secondly is obviously if we establish that teeth whitening is what they want, then do a really thorough examination. There's no holes or cavities, the fittings are all intact and sound. Check their gums, take some good quality bite wings, and if necessary some PAs, okay, to make sure there's no apical areas on the teeth, make sure the bone levels are good, check their medical history, because a lot of people take like, you know, herbal stuff like ginseng. They have some ingredients in teeth whitening gel, especially if you're doing the chair side teeth whitening with the blue light, can actually react adversely with those kind of medications, so really take a good medical history.
So once you've established that your patient is suitable for whitening, then you're looking at the color of their teeth, and this is how would you go about taking a shade?
So the Vita shade guide, which I'm sure you all have in your dental practices.
Yeah.
We use a camera like this, which I have done IGTV on cameras if you wanted to watch.
Oh,
and on my own camera actually with the settings. It's got a ring flash, so the color, the shade would be very similar to what Hava's teeth would be when we take the photos.
So would you say a ring flash is the best to get the most light?
To get natural light and to get the most likeness to the shade of patient's teeth. Okay.
If the patient's not like in any rush to do the top ones first or the bottom ones first,
that's a good idea.
And then start the second arch so that they can actually physically see the difference.
That is such a good idea. Actually, I agree with that.
Yeah.
If patients don't mind, do it that way.
Do it that way, because then you can actually see the difference for yourself rather than just from a picture.
Absolutely.
Would you say that there's anything specific you would do with the lighting in the room when you're taking a picture?
So if you're using a proper camera, you don't need to do anything with the lighting. But if you're not using a ring flash, then probably you will need to go outside somewhere which is daylight, or book the appointment during the day, so you have daylight to take the picture. Now we have got consent forms. We're on our consent forms. I don't know if you can see it. We've explained everything to them, and also at the back we have consent for photography. Okay, if you want, we can give you copies if you want. If you message
DM us,
we'll give you a copy.
I might take a copy.
This is something that we've prepared ourselves for our practice. We're very happy to share. Never promise your patient that you're going to get a B1 shade, because what if you don't? What if they've got heavy tetracycline staining and you can't achieve it? So under promise and overachieve. Okay. Let's talk about the diet. So Hawa knows what to say to the patients. What would you say, Hawa?
So we were just saying that if you're whitening your teeth, then have a white diet as well. So you know, try not to have anything with too much color. You make sure, I think a lot of patients, they know the obvious stuff: don't smoke, don't have red wine, all of that stuff, but they're not so familiar with like curries or tomatoes or oily food as well.
Charcoal toothpaste, you know, I know it comes for whitening, but I've had patients who've had veneers and composite bond-ups, and they've been using charcoal, and all of that's starting to go grey. So yes, so please tell your patients to avoid using these kind of things. The home kit, they will need these kind of trays, yeah. So like that, they are plastic and they made bespoke to fit the patient's teeth. Yeah, and you give it to your patient. They try them on their teeth, okay, to make sure they fit well.
I have like a video on my Instagram in my highlights of how to actually use the tray, so I'll show them at the appointment, and then I say if you forget how to do anything, just refer to my Instagram highlights and they can actually see how to physically do it. So it's quite good,
especially because you teach them in the surgery, but they go home and they forget.
They forget everything.
So it's good. So refer to highlights.
Refer to my highlights. You want to know how to whiten.
Night white is 16% carbon white peroxide.
Minimum of 4 hours, right?
Minimum of 4 hours on the teeth. Okay.
So you also have 6% as well. When would you say to a patient to use the 6% over the 16%?
Okay, so that was 16% carbon white peroxide. Okay,
yeah.
This one is day white and it's 6% hydrogen peroxide. Okay, so this one, the best time, this is a day white, so this is for people who do not like wearing anything in when they're sleeping on their teeth. Day white means that you just put the gel half an hour in the morning and half an hour in the afternoon.
Both of them do exactly the same thing in the same way. So it's not any better or worse, it's just patient preference about when they want to wear their trays.
Absolutely, absolutely correct. So,
I wanted to know your opinion.
Yeah.
Reservoirs, no reservoirs, and why?
So, the only time I would do a reservoir is if I'm doing inside-outside teeth bleaching. I put the gel in the reservoir. I put it in the access cavity behind the tooth where you have
so it
prepared.
just sits in that one area.
Exactly.
I always find as well with patients that have reservoirs, they end up overfilling the tray because they put the bleach just in the entire little circle.
Exactly. Majority of our teeth whitening is done for cosmetic purposes. So say if you're doing bonding on a patient, or you do changing some veneers on a patient, or maybe doing some cosmetic work, then always allow 2 weeks after teeth whitening prior to bonding or anything.
Because your enamel is more porous, right?
Well done. So what happens?
Bond is less weak.
Exactly, so it reduces your bonding, and then your composite won't last as long. So always around 2 weeks, the teeth will rehydrate, your shade will settle, and then do your whatever work you have to do.
Yeah. Well, thank you so
that's
much.
Enough. We've covered a lot.
That's a lot. I've learned a lot.
Thank you, Hawa, for doing this. She's
thank you for having me.